Welcome everyone to the latest episode of Nurturing Your Human. Today we are going to discuss a disease that the humans may get called heart failure. Heart failure is a progressive and chronic disease that decreases the cardiac output of the heart, meaning the heart cannot effectively pump blood around the body. This causes cells within the body to receive less nutrients and oxygen. Now let's discuss the normal physiology of the human heart. The heart has 4 chambers. The 2 uppermost chambers are called the left and right atria, while the 2 lower chambers are the left and right ventricles. Oxygen-depleted blood from the systemic circulation enters the right atrium, is pumped into the right ventricle, and travels to the lungs. Blood returning from the lungs enters the left atrium, is pumped into the left ventricle, and moves through the aorta to the rest of the body. In heart failure, however, the heart does not function as it should. There are 2 main types of heart failure: left-sided and right-sided. Left-sided heart failure may also be further classified as systolic or diastolic dysfunction. The ejection fraction determines whether left-sided heart failure is systolic or diastolic. The ejection fraction compares the amount of blood pumped from the ventricle in one heartbeat to the total amount of blood present before contraction occurs. The normal range is between 55 to 70%, while an ejection fraction less than 40% indicates systolic dysfunction. Systolic heart failure occurs when the left ventricle cannot pump with enough force to eject the required amount of blood into circulation. In addition, an increased amount of blood remains in the left ventricle during diastole, meaning less blood can empty from the left atrium and less reoxygenated blood can return from the lungs. As a result, there is increased pressure within the pulmonary capillaries and fluid is forced out into the surrounding tissue. Diastolic heart failure occurs when the left ventricle cannot relax fully or fill maximally during diastole, and is usually because of stiffening of the ventricular wall. Although the heart can contract normally and the ejection fraction is preserved, the cardiac output is reduced as there is less blood within the left ventricle before it contracts. Finally, right ventricular heart failure may be caused by left-sided heart failure. When left-sided heart failure occurs, there is increased pressure within the right side of the heart. This weakens and damages the right ventricle until it cannot effectively pump blood to the lungs. Also, more blood is left in the right ventricle after contraction, leading to increased pressure in the right atrium and venous system. As a result, venous drainage and return to the heart is impaired. The increased pressure in the veins also causes fluid to move into the surrounding tissue. Heart failure can occur suddenly, however usually develops over many years due to the heart gradually weakening and pumping less effectively. Hence, conditions that add stress to, weaken, or damage the heart may lead to heart failure. These conditions may include coronary artery disease, previous myocardial infarction, cardiomyopathy, congenital heart disease, diabetes, hypertension, and obesity, among other things. For example, uncontrolled high blood pressure causes the heart to pump harder than normal to move blood around the body. The left ventricle becomes stiff and thick, so it cannot relax fully and fill maximally. This may cause diastolic left-sided heart failure. In addition, if the coronary arteries become completely blocked, a myocardial infarction may result and cardiac muscle cells may die. As a consequence, the remaining muscle cells need to work harder to compensate, causing stiffening of the ventricular wall and eventually diastolic left-sided heart failure. So how do you know if your human has heart failure? The signs and symptoms associated with heart failure are due to an inadequate cardiac output and inefficient venous return. Your human may have symptoms such as dyspnea, which is breathlessness, coughing and wheezing. This is due to increased pressure in the pulmonary capillary bed and the movement of fluid into the tissues of the lung, as discussed previously. Swelling of the legs and abdomen may also result from right-sided heart failure, as systemic venous return is impaired. A decrease in cardiac output may also lead to fatigue, nausea, and loss of appetite, as blood flow to the brain and heart are maintained, while other cells do not receive enough oxygen to meet their metabolic demands. Now you may be wondering what the chances are that your human has heart failure. Heart failure is estimated to affect at least 26 million people worldwide and is increasing in prevalence. In 2016, it was estimated heart failure affects 1 to 2% of the population in Australia, while in 2018, approximately 480,000 people aged 18 years or over had heart failure. In addition, Indigenous Australians are 1.7 times more likely to have heart failure than non-Indigenous Australians, and there is increased prevalence of heart failure with age. So remember, if your human is looking tired, out of breath, or loses their appetite, it may not be because you upset them by vomiting in their favourite pair of shoes. They may have heart failure. Thank you for tuning in to Nurturing Your Human. See you next time.